My name is Natacha Bolaños. I'm the head for membership and alliances at Lymphoma Coalition. Lymphoma Coalition is a global network of 83 patient organizations from 52 countries around the world. The vision of Lymphoma Coalition is equity in lymphoma outcomes across borders, and our current strategy is focused on ensuring impact within two pillars: information and advocacy. What supportive care is needed for patients receiving CAR T-cell therapy? Well, this is quite a challenging question. I would start by telling that the origins of the terms supportive care and palliative care differ, but are often used interchangeable, and they have some similarities, but their goals far outweigh their distinctions. Studies have shown that patients and providers, healthcare providers, have a more favorable impression of the term supportive care than palliative care. And that's why we are trying to use this term instead of palliative care, because misperceptions by clinicians equating palliative care with just end-of-life care are not always helpful for the patients. Supportive care is defined as the provision of the necessary services for those living with or affected by cancer to meet their principal physical, emotional, social, psychosocial, informational, spiritual, and practical needs during the diagnosis, treatment, and follow-up phases. Encompassing issues for survivorship, palliative care, and of course, palliative care is explicitly recognized under the human right to health, and should be or has to be available at all levels of care. When early supportive care is administered alongside the CAR T-cell therapy for specific blood cancers, this could be beneficial for advanced care planning, for symptom management, for detecting earlier the needs and preferences of patients and also their caregivers, and emotional and psychological support needs. Unfortunately, patients are often referred too late in their treatment pathway for this supportive care, so they may not get the opportunity to discuss their priorities and wishes while they are well enough to do so. So what I would like to remark is that early integration of supportive care alongside active treatment should be the model of choice in hematologic settings in order to achieve the best outcome and improve quality of life for patients. It should be provided through person-centered and integrated health services that pay special attention to the specific needs and preferences of the patients and their caregivers. And CAR-T shouldn't be different in the sense that as soon as the patient is referred to this therapy, we should start with the assessment of needs for that supportive care and facilitate through a multidisciplinary care team, especially with an integration of nurses, rehabilitation, and nutrition, psycho-oncology support, and all the needs that they may have. And consider also that these needs are not static, so they can change across the treatment journey. So it's important from time to time to review again what those needs are and try to meet the needs of the patients with the supportive care pathway required.